Okay, it's 1:20, and 20 minutes goes really fast. I'm sure you all saw from the first session. And if everyone can just turn on their videos, if that's possible, it'd be great to see who's here. Thank you. I'm Dina Fuchs. You may have met me earlier. I'm just here to introduce Brian Gralnick, who's going to present on measurement and evaluation. Brian is the Director of Social Responsibility at the Jewish Federation of Greater Philadelphia. And again, 20 minutes goes fast, so I'm just going to hand it right over. Thanks, Brian.
Great, thanks, Dina, and thank you all for being here today. Majority of my comments are going to focus on sort of how we at the Jewish Federation in Greater Philadelphia are managing and measuring our collective impact as a community. So most of that is going to focus. Most of my remarks are focused on that, and then a little bit, we're going to talk a little bit about sort of how we handle evaluation with our partner agencies on sort of an ongoing basis. I'm going to try and leave some time for question and answer, but since we are also a small group, feel free to sort of unmute yourself and just ask your question if it's timely. I'm hesitant to sort of go into the chat box because it can be a little distracting. So I want to take you back to 2008 when we sort of started our quest to find out how many unduplicated people we are serving through our grants at Jewish Federation of Greater Philadelphia. And I know it sounds like, such a simple question. How many people are you serving? How many unduplicated people are you serving? But as I'm sure you can tell, it is a mammoth effort. And I joked in the last session, sometimes it feels like it's a saga or a quest as long as sort of the Star Wars franchise. But just to give you some background, in 2008, we started to study how we would end hunger in the Jewish community in Greater Philadelphia. We hired some consultants, and they had some, pretty important things to say. Talked about promoting client choice and reducing food waste, streamlining operations. But the biggest point was that we were funding a number of food security agencies, and we had no idea how many unduplicated people we were serving. So in 2008, we had our 5 mitzvah food program food pantries, which we run internally at the Jewish Federation. We're funding an agency called the Jewish Relief Agency, which one Sunday a month, 500 volunteers pre-COVID would pack a box and get delivered to like 3,000 households. We were funding the former JCC Senior Center, which has a private Meals on Wheels program, a senior center that was doing congregate meals from the Area Agency on Aging, as well as a program called the In-Home Support Program that helped people get out of a nursing home or a hospital and transition them back into their own homes. That one agency that had 3 programs, that agency still today does not have a unified database that can sort of tell you how many unduplicated people they are serving within that building. And then if you add in our JFCS, which does great work helping people enroll in SNAP, the Female Hebrew Benevolent Society, which is one of the oldest organizations in the country, dating back to 1918, providing gift cards for supermarket gift cards, and lastly, our Federation Housing, which is doing subsidized senior housing in about 10 buildings throughout the region, and we were providing and granting them funds for congregate meals. So we've got like 10 programs and no idea, if the same Mrs. Goldstein was getting services, if they're serving the same, 500 people, or if we're actually serving 5,000 people. So we took on, quite a lengthy process to figure out, how do we figure out how many people we're serving? So we looked at other sort of social service systems and looked at HMIS, or Homeless Management Information Systems, where homeless shelters in a county or city are sort of reporting up to the county office, whereas, you're not really going to have one individual sleeping in 2 shelters in the same night. And sort of use that as sort of our rubric to figure out how we come to create what we now call this integrated data warehouse. So I'll fast forward in terms of, we had a robust committee of professionals, et cetera, et cetera. One of the things that we didn't do well and sort of is a real lessons learned is that we created this database on a sort of SQL server, which you don't really need to know about. What you need to know is that we sort of created our own database. We did not go with an off-the-shelf product, which we very much regret at this time. Right now, our IDW is sort of, in the cloud on something we own, but we're very likely moving it to Salesforce in the next year or so. The second thing is, even if we did go with sort of a custom build, it would have been more cost effective to do that in-house and just hire an in-house coder instead of sort of outsourcing it as well. I know that would have, of course, impacted our headcount, which some nonprofit execs are a little concerned about, but really it would have been much cheaper overall. So, after a year of convening, dealing with a lot of issues around HIPAA and high tech, I would say, excuse me, that's, the perception of HIPAA, I think is more of a barrier than HIPAA itself, but I'll come back to that in a minute. We all signed a business associates agreement. We all worked very closely figuring out, the exact sort of data and sort of definitions of the data that we had. So we were then all on the same page when we had 8 agencies or 10 agencies essentially break all of their client databases down into a CSV file, and then we merged all of that data into the cloud. We then had developed an algorithm to determine, is this the same Mrs. Goldstein? Are we looking at this person's phone number, address, and other basic data that we are collecting? Very few of our agencies are collecting social security numbers. So we're really not going to use that as a metric. And obviously, we're not trying to, collect everyone's most personal information as well. So I'll just, sort of skip to some of the initial results. Excuse me for a minute. When we dumped all this data in, a few things were apparent. One, how clean the data of the agencies really is. As a federation, we're getting evaluation reports and sort of seeing, the raw number, but we're not actually seeing sort of the quality of their data itself. And of course, we're not seeing the client names either. And the biggest takeaway was that, and really part of our, goal was that we were able to see how little client overlap we had. When I mentioned just those food programs, I should have said, which I probably don't need to, that although they are very similar in nature, they are not duplicative, those food programs, and they're actually much more complementary. And we don't necessarily think that, one bag of food once a month is really going to solve someone's sort of food insecurity challenges. So back to the data, there was a really strikingly low client overlap rate between our Jewish agencies, which really unfortunately meant that we were acting more as sort of, sister agencies tackling a common problem of Jewish poverty, as opposed to a real communal system where there is sort of seamless handoff and trade-offs from one agency to another. So there was a lot of work that came out of as a result of this. One, it showed we really needed to educate the communal staff about each other's services, whether or not that was sort of like a staff, local mini mission, or JFCS and our JEVs, really two of our larger agencies, set up regular meetings between sort of their care managers so that they can work a little bit more collaboratively on behalf of different clients. So it was a lot of sort of positive work that happened, not just as a result of sort of, the end product of the IDW, but also sort of the process of convening people as well. So I just want to pause there because I'm going to, sort of dive into a little bit more granular of our work. But I wanted to see, I sort of gave, a 10-minute presentation that normally takes, an hour or so. I just wanted to pause and see if anyone had any specific questions. Go ahead.
If I missed it, if you already
Yes, Cindy.
guys. So is it so all the data from the different organizations is being collated through Federation?
Yeah, so Federation is an administrator for the integrated data warehouse. We don't see individual client names. Every agency on a regular basis, depending on client change, how often their client data changes, dumps their data into the cloud, where then sort of an algorithm sort of deduplicates it.
So with an agency in the community that has capacity to do that kind of thing. So that's
Yeah, that's right. And we were working with agencies that were having their data on an Excel spreadsheet to a nursing home that has a very sophisticated electronic health record systems. And one of our agencies, quite frankly, I think was still using index cards at the time we started, but then sort of moved over to Excel. So I mean, one of the nice things is that it is really essential and it is relatively easy for most programs to sort of dump their data into a CSV file. The common element to use to identify individuals, it does every client gets a unique identifier when their data goes into the integrated data warehouse. But from there, it really sort of depends on the algorithm to figure out, is this the same Mrs. Goldstein or are they two different Mrs. Goldsteins? I do want to say there is absolutely an ability for the staff of the agencies to go into that client's profile and say, yes, confirm this is the same Mrs. Goldstein, or no, these are in fact two different Mrs. Goldsteins. And quite frankly, that is not happening all that well. Great question. In terms of what do we do with all this data, we share it regularly with all of the agencies. We have sort of annual meetings at the start of the fiscal year, and this is always information that we share with the agencies so that they can sort of see the progress that we are making with as a community. This very much is not data that is just to be shared with Jewish Federation. We share it with our lay leaders as well as with our community as well. And the other aspect is that there is sort of like an e-referral mechanism currently too. So I'm just gonna take a look. I know there were some other questions. Yeah, so in terms of, sorry, I spoke real quick. So currently our integrated data warehouse is on a SQL server sort of in the cloud in which we own the code. But it is really a little bit of a clunky system, and we think it would work much better moving it to Salesforce. And in the sort of 10 years, not 10 years, in this sort of 5, 6, 7 years we've started this, several of the agencies we worked with have actually moved their client databases over to Salesforce as well. So we think that's why another reason it'll be a good platform. Aviva, I see your hand up. Do you have a question?
So you were talking about the importance of discerning the difference between being sister agencies and really a network. Do you think that you've become a network, and has there been talk of merging these agencies?
Great question. Yes and yes. We still have a lot of work to do. The JEVS and Jewish Family Children Services has made a lot of progress, but our sort of food security agencies, sort of the food pantries and sort of, not necessarily mom and pop is the wrong word, but we do need to have more client overlap between some other agencies that are not necessarily doing sort of intensive client work. HIPAA, was a significant factor. Certainly the perception of HIPAA, a large factor. One of the things that was very helpful is that we hired on a low bono rate, a well-known law firm in Philadelphia that had a robust healthcare practice. And their sort of number 2 was our sort of healthcare attorney advisor, who was very impartial, which was great. Many of our agencies have sort of some counsel for healthcare, but this individual sort of acted on behalf of the project and really helped sort of push it through. And our clients are signing sort of a HIPAA release, and that is sort of an extra piece of paperwork that they do need to sign. But overall, it is going relatively well. And it's not just HIPAA, but there's another law called High Tech that also needs to be paid attention to as well. And almost all of our agencies all signed a business associates agreement in order to sort of share that information. I'm just looking at Rachel's. Rachel, do you mind just stating your question? I don't quite see you, but you could just.
I had a couple, but one was, I guess, how has this information been useful for the agencies and the service providers? And the other part of my question too was, did you have to come up with common definitions? For example, what is a client? Is it someone you saw in the last year, in the last month? How did you kind of come up with that with all these other agencies?
Yeah, great question. So yeah, the agencies are very interested in this, and this really, it is tough to make this work if the agencies don't have, good buy-in. And I'll credit to the head of sort of evaluation at Jewish Family and Children Services, Paul Grouch, who is a big supporter of this and really sees the value in sharing client information, or at least having an unduplicated picture when appropriate. I'm sorry, the second part of your question, Rachel?
It was about common definitions, like
what, yeah, absolutely.
Who is a client?
Yeah, there was a lot of work, and that, was sort of the monthly convening that we had for over a year that we worked with the consultant, not just about sort of what is a client, but sort of how are you recording your information, and that's when you get into, are you recording things like, just male and female, or are your agencies a little bit more 2020 in terms of how you're recording gender identity? So all of that stuff has to sort of get meshed in, and it has to like be made to work in order to sort of make that meal. We just have 4 sort of minutes left. That's unfortunately not enough time for me to sort of go into some of the in-depth stuff around our one of our food pantry grants working with the National Institute of Health. But the other thing I just want to say in terms of sort of a little bit more practical day-to-day evaluation stuff is that at Jewish Federation, we do have a pretty robust evaluation department. And they, along with myself, meets with every agency at the start of the program year every summer. I should say prior to the program year, and whether you're sort of a pilot program or the Female Hebrew Benevolent Society from 1819, we sort of chart out sort of your evaluation plan and your measurement with the agency for the upcoming year. We sort of review the client satisfaction surveys. We sort of talk about, industry best practices and, where you are sort of sourcing your surveys and your evaluation from, and sort of act and try and support the agency as not just their grantor, but as their partner and somewhat of their outside evaluation consultant. And some of the work, some of the pushing that we have done for some of our agencies, really has made them more competitive for other grants from other foundations and even from state government entities too. And just one little nuance about that is we have found it really effective that when we meet with every agency, sort of chart over their evaluation metrics, and then, just something as simple as sort of emailing that out, by Labor Day, so that when, if by chance there is a discussion or a question around some of their deliverables, we can sort of refer back to, that email and that discussion as, sort of proof in the pudding and what we discussed, if you will. Just a little, somewhat of a no-brainer, but really practical information that we found helpful. Right, so Linda, great question in terms of, diving in a little deeper about interventions most helpful for poverty reduction. We really, unfortunately, don't have a lot of time to get into that. I would refer you to the CJP Boston model has a very good sort of matrix that they have worked around self-sufficiency as well. As it relates to food insecurity, we are using, the USDA has something called the 6-item short form, which our food pantry is administering on an annual basis. And that really tells us the degree in which someone is food insecure. So we are trying to track that on a longitudinal basis at our food pantry to sort of figure out, to get to that granular point you were talking about, Linda, are people less hungry? Are they, do they have more resources at the end of the day? And hopefully, we can continue those conversations about sort of metrics and outcomes for poverty reduction in future FedLabs and sort of future discussions as well. So we have 2 minutes left. Try and put some resources. I do want to add another resource, which I'm going to put to everyone as well. Susan did a great job of putting the client in the center of our work. And I just want to put something in the chat. Last year, I attended a conference from our sort of regional secular trade association and philanthropy, used to be called Delaware Valley Grantmakers. And they had an organization called Chicago Beyond. And they gave a keynote, and a good portion of the keynote was sort of coming from the client in terms of their perspective around research and evaluation. So I just want to put that in there as one resource, and I'm going to just jump to on my computer the USDA short food insecurity survey as well that we're using too. Sorry about that.
I just want to add, there are a number of videos and briefs on the Poverty Affinity Group website. So I put that in the link as well. And there's going to be we have a 16-page PDF that captures everything that's gone on in all of these success factor sessions, which will be sent around after the federal check.
Any other questions? And I'll hang out for a little bit as well. Since I am filibustering and I have the mic, I just want to take this opportunity to thank Dina and everyone at JF and Jewish Funders Network for really all of their hard work in putting together this FedLab and really this, really wonderful GA. It's been, a lot of worthwhile and informative stuff. And you never know when you're making lunch on the East Coast and then you're put into a break room with Mark Wilf and 2 other people, lots of wonderful interactions can happen here. Well, thank you all for joining. And again, I'll stick around in case anyone has any specific.
Thanks, everyone. And thank you, Brian, for making the time. There's a 30-minute break now. So if you do want to stick around and you have the time, it's a good opportunity to leave the room open. I put the, I'm putting the program back into the chat. We'll be meeting again as a group for a little bit before we move into our community work groups. So we'll see you in about a half an hour or so.
And I did put my email in the chat as well if anyone wants to sort of follow up. If anyone wants our sort of IDW client or lease, I'd be happy to share that to you as well.
Thanks, everybody.
Thank you.
Thank you.
Brian, I think that you're going to have a lot of helpful information as we're moving through COVID that will be a really helpful reference point since you'll be able to do some, you'll have baseline pre-COVID and currently. So I hope that you'll consider how that might be helpful, that different communities might be able to, adapt it to their own community just conceptually, but just as far as impact on current or previous clients and new clients and, newly impacted by the financial challenges and mental health challenges.
Yeah, we're happy to share everything that we've learned.
Thank you.
Hi, can I ask you a question?
Sure.
Thanks. That was a good presentation. I know you have a lot of information. Try to condense. So this project, I heard you say at the beginning, the project grew out of or the database grew out of a project about eliminating food insecurity among the Jewish population in your community. And did the database then go on to collect other information, or is it all focused just on hunger among?
It's all social service data from all of our unrestricted grantees for social services.
So you started out with an eye collecting from the programs doing feeding, and then you started collecting data from other programs, and the idea was to what? Create a unified database of Jews in the community who are getting supported by programs for whether it was food, or they needed money, or they needed home care.
Yeah, exactly. So that was 2/3 of it. And then the other third of it was to have a tool to allow the agencies to essentially have electronic social service records, so that if you were going to the food pantry, I could sort of refer you to JFCS to say, hey, this person might need a grant to help with their, rental payment, or they might need some additional help enrolling in SNAP. And by the way, they just gave me 15 pieces of information about them. You don't need to ask them the same time because you're a MSW social worker, and here is their information, and certain things frankly are a little bit below your pay grade and a little inefficient. But we frankly haven't gotten quite there in terms of the electronic social service record system. The other thing, which I'll say, I said this sort of last year, and it was a little harsh, but when you sort of look at the Federation systems, and I know some of my colleagues would agree, we're like the most inefficient managed care organization like in America, in terms of like the lack of coordination and sort of just like the lack of, IT aspect that we have. We're spending millions of dollars out in the community, and a fraction of that to figure out how many unduplicated people we're serving, or to make things a little bit more efficient, in my opinion, would.
So do you think that if like Jeffna had created a database, and then every community could use the same database, that would be a helpful, good idea?
Yeah, that would be helpful, whether or not it was sort of Salesforce or something else. And that sort of goes along the line of what JFNA does. I know they've been very active with BBEC and Blackbaud and sort of helping agents, communities sort of on the fundraising aspect, but there's a real need on sort of the social service aspect too. But I will give, I do want to give a lot of credit to Weinberg, because I know Jonathan Hornstein is very much, someone who's paying attention to these issues, and someone who's very aware. And I know that the Weinberg Foundation in Baltimore does look at IT as capital, and they have a rolling application for capital needs.
Yeah. All right, great. Thank you. Thanks.
Anyone else have any other questions?
Yeah, how much staff time do you think
this program took? Is it like to put this together? Is this, I mean, I know you spoke about the consultant and the lawyer and.
It's it's a significant amount of time. I mean, you need to, there's a lot of convening on the agencies. In an ideal world, I would have given planning grants to all of the agencies for coming to these meetings, like $5,000 or so. I think planning and sort of participation grants, at least in Philadelphia, are becoming a little bit more of the norm. So I think that would have been a positive incentive, but we didn't, and they really still came anyway. But it was like years of work. Probably 18 months or so worth of work. So I mean, it's a significant amount of time for us as planning staff. I will say, just on the lawyer, we earmarked $50,000 for legal fees, and it sort of got into a gray area because the attorney sort of took it on as pro bono, which we didn't quite really ask her to do, but obviously if she does, but if she wanted to, her billable hours were probably like $150,000. So you do need someone, some sort of attorney, to give you some sort of low bono rate, or if there's someone connected to the Federation who is sort of a healthcare attorney that wants to sort of in-kind it, that can sort of be that arbitrator or mediator, that is helpful too. But yeah, you definitely need a healthcare attorney for sure, for at least some of it.
Thank you very much.
And feel free again to email me, and I can give you some other sort of information, our client release and other things, and background information about the IDW too. I'll probably can give you sort of like our whole user manual, since just sort of like the 5 of you, if you want to email me. Alan, you have information.
Brian, I have a question or two. First of all, thank you for the information. Looking back, what would be things that you would do differently? I know you had mentioned not creating your own database, but what are some of your big lessons learned?
You need to get buy-in from the agencies, or it's going to be so much more difficult. The more excited.
How hard was it to get buy-in from the agencies? I mean, because here they are taking their confidential data of their clients and then sharing it with, some of them might be perceived as competitors, some might be collaborative partners, and so how's that buy-in?
It was work. Sort of the more sophisticated the agency. Let me strike that. The only artifact that made it was sort of that op-ed from the New York Times, which is a little outdated, which sort of talks about the perception of HIPAA as a barrier, and that was not insignificant. I think people overall say they want to be team players, and I do think they do want to be team players, but they're very quick to sort of put up, roadblocks of, HIPAA. People throw out HIPAA sort of all the time, I feel like, in our field, when it's not quite applicable. So that certainly is a roadblock. And sort of one of the other ways we dealt with that, which I think is very appropriate, is that when you sort of look at the IDW release, is that we give not just the clients the ability to choose who they share what information with, but we also give the agencies the ability to share what information they share with others. So there'll be, this actually happened. There's, let's say there in Philadelphia, there's agency X. They had a donor they went after to buy them a new building. And I think the donor said yes. And I think what happened is they went back to the donor and said, you know what, we actually need a little bit more for you to name this, and we'd like you to give us a little bit more. And there wound up being a lawsuit with that donor. That donor wound up buying a building for a sister agency. So needless to say, these two agencies do not work well, and their board chairs aren't having Shabbat dinner. So that one agency X, they will not share any client information with any other agency, but they'll still dump all of their client information into the cloud for purposes of unduplicating and figuring out how many unduplicated clients we have. So the agencies can sort of pick and choose who they want to share what information with. And then when you see the client release, they can determine what agencies they want to share what information with. And then it is on sort of whatever social worker or whoever is at that agency when they're sort of uploading the IDW sort of paperwork to sort of check the fields that this person is only sharing information with agencies A, B, and C. So we try and empower and give a little bit more tools to the client and to the agency to sort of address sort of wariness about competition as well. And then, I'm sorry, I don't remember if it was, I think it was actually someone else who said it, but I wanted to, at least for this small group but yeah, we are looking more at mergers and consolidation as a result of this work. And I mentioned that we run 5 food pantries in-house, which I know is a little unique for some federations. We used to run a NORC in-house too, a naturally occurring retirement community, and we just outsourced that less than a month ago. And this had been a program with us for about 15 years, and in part because of the IDW showed that we really need to, get more, client overlap. It made sense to just discharge this program. And we frankly looked at JEVS and the senior center and JFCS, and it went to it went to JFCS rather. But certainly consolidation is certainly something that is relevant.
Thank you.
I know I don't think that was your specific question, but I think it's still relevant.
No. Any other lessons learned? I know you talked about getting the buy-in from the different constituencies. Anything else come to mind?
Yeah, so one of the other things that we thought a lot about is a frontward facing sort of extension or portal for the integrated data warehouse. And I think it's only, more relevant, in COVID, quite frankly, and in 2020, because sort of as, clients, as sort of the older adult population sort of passes away, more and more people are internet savvy, clients, could theoretically access, some information or put in some of their own information directly to maybe speed up the process. So that is something that we've thought about. We've looked at something from a group called Benefits Data Trust, and they have something called PRISM. Let me see if I can, now I can't find it on a quick Google search, but yeah, that is something we were looking at as well. And just being mindful from the start about sort of HIPAA as well, because we sort of, went back and sort of added sort of HIPAA privacy stuff into the integrated data warehouse. And it just made it very clunky and not super user friendly. So it doesn't get as much usage as it should be getting.
Thanks.
Oh, you're on mute, David.
I'll mute you. There you go.
Sorry about that. First of all, it's fantastic what you're doing. I really admire all of this. And I'm curious if it's connected in any way to government benefits that people are eligible for. I mean, there's connecting them to all of the resources through the Federation network, but then, these are people who also probably qualify for all kinds of government benefits as well.
Yeah, we certainly want to be tracking that information, and that's really, some of the most important data for us to be tracking. We have, 2 of our biggest programs are our food pantry and this Jewish Relief Agency, and together, potentially duplicated, they're serving like 12,000 people, and together there's 3 social workers for, those individuals. So tracking benefit enrollment was really one of the most important, pieces of data that we have, and low SNAP enrollment has sort of been an ire and a thorn in my side. So we've done 2 different projects related to that. First, and this is actually our first sort of data sharing project, we had all of our agencies dump their client information to an organization called Benefits Data Trust, and they essentially do sort of direct mail to individuals and sort of telephonic support and outreach to help them enroll in benefits. So that was beneficial. And then we actually hired a political firm. And I talked about this last year a little bit. We hired a political firm that was started by the Obama campaign leadership that has an expertise in data mining and data modeling. And we paid them to data mine and model the Jewish community in Philly. And they gave us a whole bunch of contact information. So we gave that information to Benefits Data Trust, and we did sort of the second outreach campaign around SNAP enrollment. But yeah, the short answer is yeah, recording sort of SNAP enrollment and whatever we can do to make that more seamless is something we are interested in doing, but we haven't quite figured out sort of connecting this IDW as part of a platform to help someone enroll in SNAP as sort of that funnel, if you will. I mean, of course, theoretically, we could just sort of hyperlink, something to the Department of State or the Department of Human Services and from that application.
Do you know about the single stop program that started up in New York? So that allows people to understand the full range. It's not, just go sign up for SNAP, but here's all the things that you qualify for, and here are ways to get there. That would be an amazing thing if you could somehow figure out a way to.
Yeah, that's what this community prism of benefits data trust sort of is meant to do, is sort of just have clients be a little bit more proactive in it, as opposed to needing some help from someone on a call list.
All right, thanks.
Okay, I'm gonna have to close the room in a minute or two. Carmen, do you have any questions for Brian?
Thanks, guys.
Okay, great.
Carmen, I just want to say,
Good to see you, David.
bye. Did you have any questions, Carmen? Okay, all right. Thank you all. Thanks, Tina.
All right, thanks, everybody. Take care, bye-bye.